with another conversation with our healers today. Humanizing Our Healers is an initiative by Caregiver Saathi, where we are aiming to highlight how human our healthcare professionals are. Today, I have a very special human being amongst us. Anyone who knows about palliative care in India would know how human this healer is. Dr. Rajam Iyer. Welcome, Rajam, for this conversation today from the entire team of Caregiver Saathi. And thank you for accepting to speak to us. For the sake of the viewers, can you please share who Rajam is?
Sure. Thank you very much, Vandana and the team at Caregiver Saathi for this opportunity. And I'm very humbled to be called a very human healthcare worker. I can say that though I'm a South Indian, but never lived in the south of India, I've only lived in Bombay all my life. And despite the fact that I've been a doctor since 1986 is when I joined my MBBS journey to become a doctor. I think the past 5 years of my journey in palliative care is where I have really become a true healthcare professional. At home, it was always something considered very proud moment for my parents to have one of their children as doctors. Despite the fact that I think my sister, who's the only other sibling I have, has done exceptionally well for herself and lives down under. But I think my journey as a doctor changed in the passing away of my dad. And I think his death is what changed my course from being a pulmonologist, which is a chest specialist, to becoming a palliative care specialist also. And I think that transformation, I owe it to him, that even in his death, he showed me a way ahead, a light to, a journey or a path where I really blossomed as a doctor, and where I could marry not just curative, but also palliative care options for my patients and caregivers. Because I think in the past 10 to 15 years, I have been the main carer for my parents. So I know what it is to be a caregiver. And that's why I'm very closely associated with Caregiver Saathi, and kudos to the work they all do to support caregivers. So this is what I am. And I think I'm really glad to have found the path ahead of palliative care. And it has opened a whole new world for me.
Thank you for sharing that, Rajam. And palliative care needs human doctors like you, because in India, which is so much missing, it's really missing, but there are very few palliative care physicians in India. So thank you for being a palliative care physician. So last year and a half has been really rough for humanity, Rajam, and it's impacted every human being. While there are non-medicos who did take the brunt of the pandemic, it was the doctors and the healthcare professionals who went beyond the call of their duty to serve humanity, to ensure that people got better. Though lives were lost, but people got better because these medicos stood side by side. How has your experience been in the last year and a half? And how has it impacted you professionally and personally?
So I think you're very correct about the fact that no human has been spared the trauma and the cruel, excruciating times of the year and a half. Everybody is affected by pandemic of COVID caused by COVID-19. So we have set of people who have been infected by the virus, and therefore those people who suffered and their caregivers, and obviously the loss of people forever because of the pandemic, those who are never going to come back. We have families who have suffered more than one losses during this pandemic. Then we have those patients who probably died during the pandemic, not because of COVID, but other chronic illnesses. They also didn't have a decent exit during the pandemic. They were also not grieved in the manner that normally people would have. So those families and those patients who died not due to COVID, but during the pandemic also suffered. And of course, there's another huge lot of people who were affected by the pandemic. So those who lost their livelihoods, those who, elders who stayed alone, the vulnerable age groups who never met their families from the West or who couldn't travel. So there's this children who, were probably suffering because of staying at home 24/7 with grown-ups, domestic violence, our staff at home who suffered because of staying home cooped up with five other people. So yes, it has not spared anybody. And I think for healthcare professionals, it was a huge change because in our lifetimes, so that means healthcare workers from the age group of 20 to 70 have never experienced such kind of a catastrophic medical disaster in our lifetime. And I think it exposed one of the biggest truths of the infrastructure of this country's healthcare, and which is what is something that we've been saying all along, because I think the per capita expenditure towards health in this country is abysmal. And I think the pandemic really exposed it. Of course, people can argue by saying that even the Western countries like America and UK were brought down to their knees. But still, the harrowing incidents which we saw in the second wave, especially of people dying without hospitals, beds, people dying without oxygen, people dying because of fires in the COVID units, these things are absolutely not acceptable. I mean, yes, people die of COVID, but it is at least we should have the satisfaction of giving them the best treatment. So I think as healthcare workers, we have seen this entire spectrum of people who have, suffered many losses, who have not got the health adequate resources, and we have lost our own people. We know of friends, especially pulmonologists, who have been in the thick of things because COVID mainly affects the lungs. I wouldn't say
Right.
only, but pulmonologist friends, we have seen them suffer in the ICU. We've seen them undergo ventilation and then, really struggle back to life. We've also lost a lot of friends. So I think it has been an emotionally extremely traumatic time for healthcare workers. And I think it feels sorry to say that, somewhere I think it is wrong in our country to equate us to gods, because we are also humans, and somehow people don't realize that we feel, we hurt, and we emote, and we also have families, and we also have to get back to work. So I've had a lot of my friends who have actually been stigmatized to come back to their building societies. We've had friends of mine who've not been able to go back home for 3 to 4 months because they've worked in COVID wards. And so this kind of stigma hurts. We've actually dropped everything, stopped our life, paused it to see to it that people recover and go back home. And to be treated this way is hurting. So my sincere request for people, I know they are probably doing it because of their anguish and their loss, but stop back and think you're also hurting a fellow human being. And I don't think it really gets anywhere any worse, because even for a day, if you imagine that the doctors stay off the wards or off their duties, just imagine how our crumbling healthcare will completely stop and shatter.
Absolutely.
So I think it's
Absolutely.
very important to introspect. It's about anything, Vandana. I mean, I think in any argument or any difference of opinion, we need to have the maturity to agree to disagree and walk away from there. It's okay. You can't please everybody and you can't satisfy everybody. At the same time, we really need to keep our maybe tempers, anger, our attitude to people, and check that before you talk and hurt people, because I really don't think, even if you, so my whole mantra in life is, if you can't benefit somebody, don't go out of your way to hurt somebody. I think
Right.
you should just stop there, and that's my request to everybody, that yes, we doctors, especially pulmonologists, have gone through a lot, and it will really help, even if you can't turn around and say thank you, it will really help not to bicker, not to say I was not looked after well or XYZ, and even things like the civic cleanliness of hospitals. A large part depends on the patients. I
Absolutely.
mean, yes, doctors do have a role where we can complain to the admin, but it is how every patient uses that particular restroom or a washroom or keeps his bed and the surroundings. It is our responsibility. So if everybody thinks and does their bit, I think we will be in a much better world. And that is the request. And it's not just during the pandemic. I think it's a learning for all of us from the pandemic, that the least we can be is kind and compassionate to each other.
To each other.
And if it happens to be a doctor, absolutely great.
Yeah. Thank you for sharing that, Rajam. And you've, actually highlighted some very, very important points. First, which I actually wanted to speak about, is the impact on pulmonologists. People don't realize that how pulmonologists have really been hit hard. Critical care intensivists and pulmonologists, they have faced the brunt of it. And like you said, no doctor ever wants to lose a life or not be there for the patient. So when patients get these, they make these demands out of the doctors, which is very, very unfair, because if a life is lost, it's not because the doctor uh, did something. It is because there was a situation when nothing could have been done. So though people have been anguished, but they should be supportive as well, because like you said, doctors are human beings, they're not God. So let's all treat them as these special people who are there to heal us, but they're not gods. And they do their best, but at times the best is also not enough. And let's just realize that, and let's just support our doctors. And also, like Rajam said, sometimes we have to be in it together. And something so pertinent she's spoken about the hygiene in a hospital. It's so easy to complain. But if we can work together, like for example, going to the washroom and just putting some water by yourself can reduce the load on the healthcare professionals. So if we work together, we can actually do so much better in difficult situations like this. So thank you for talking about that, Rajam. It is so, so important for everyone to know this, that basically, pandemic or not pandemic, it is human beings who have been affected. And where, as human, we should be supportive of each other. We should be compassionate towards each other. You also spoke about losing, people known to you, doctors losing their lives, and other healthcare professionals losing their lives. And there must have been some patients also who lost their lives under doctors. And a lot of time, the people don't realize, the non-medicos don't realize about the vicarious grief. They take it for granted that doctors, it's okay for a doctor to see death. It's not okay. They hurt as well. So can you just, speak a little about that, share your experience with that?
Sure. And just before I take that question, Vandana, one thought that came across to my mind about when we see death and the way we experience it, and it's not that we have not tried everything for that particular patient. So one of the things like I want to reiterate here is, in the pandemic, yes, there has been a lot of patients at the same time who have been sick. So yes, as human beings, we also fall short because we also have two hands and two legs, and there's only that much one can do. And in a private hospital, it's very different, because in a private hospital, you can choose saying, I wo abhi aur patient nahi dekhunga, let give it to the next doctor. But in a public hospital, there is no saying no. The young and the doctors in the public hospital who are actually handling the front line are young 21-year-olds who have never in their life even seen a death, forget so many deaths at a time. So my whole take on this is the specialty that I'm now into is I really think palliative care should be in a big way in the training of medical doctors, because it not only helps triaging and selecting patients, picking up patients who are sick to go into the hospitals, telling those patients who are not going to make it to ICU, teach them the good communication skills, teach them medical ethics and the attitudes to deal with difficult relatives, angry relatives, all those kinds. So palliative care is one ammunition that can really benefit doctors, and that has really kept me afloat in the pandemic because of the way the manages. The point is, you can only do that much, but yes, at least you're there, being there for the patient, being connected, whether it's virtually, SMS, voice call, WhatsApp call, Zoom call, or physically being there. I think it makes a huge difference for patients given their level of suffering. The point is, if children in medical schools are taught about palliative care, attitudes, ethics, communication skills, they are armed with dealing with such stressful situations. So if people like me were trained 30 years ago in palliative care, I think we would have handled the pandemic much better. So I think that is one thing I would like to emphasize, because I really think during the pandemic, I remember very clearly the early days, March, April 2020, I was called in to speak to a 75-year-old lady who was going back home, cured with COVID. But the reason I was called was, in the 12 days she was in hospital, she had lost two of her sons, aged 40 and 50, with COVID.
Oh dear.
And the primary physician was so overwhelmed with work that he just couldn't bring himself to talk to that 75-year-old mother. And for me to go into the COVID ward, I was probably very glad to be in the PPE because she couldn't see my face. And I knew how choked and emotional I got telling a 75-year-old mother that she's getting discharged and she's going to go home on the 13th day of her firstborn. So, it's gut wrenching. And I had to take the help of the widow of of that 50-year-old person who died, because at least she knows the voice and the touch of her daughter-in-law.
Yeah.
And that brave lady came actually all the way, leaving her rituals. She had lost her husband and her husband's brother. And she came with me to offer me support so that I can talk, because the board was worried that we were sending a 75-year-old home with a diabetes and ischemic heart. And if I'm telling her there's such a bad news, we probably have another medical emergency on hand.
Right.
This kind of situation is something I will never ever forget, and then you have a situation where you have an 86-year-old who is on 10 liters of oxygen with bad lungs, and the family is not ready to let go. The family wants everything done for the patient. And when the patient probably has clearly said, "Mujhe hospital mat le jana," just because of the fact that one can afford, or God has given you more time to reach the hospital, or the resources to get a bed and a hospital bed, we probably, there's something you feel hits you, that a 40-year-old didn't get a bed, and an 86-year-old is holding on to a bed. He doesn't want to live, but the affording relatives or the influential relatives don't want to let go. So these kind of situations stare at your face and, am I doing right as a doctor? I'm not God. I don't want to play God. God, it's very sad that we can't save 40-year-olds. We've not tried enough, and we don't let go of dignity. So this is where I feel the sense of palliative care training comes to you, because you then have the wherewithal to sit and talk to relatives about futility of life prolonging treatment.
Absolutely, Rajam.
And also about the torture in the name of love and in the name of caring for your elderly parent. You're actually torturing them. And this is what I meant by saying earlier to you about NRI children and parents. That has hit the most during the pandemic, to leave your parents in 80 plus alone in a city and have no backup, and then expect friends or doctor friends to rally in a lockdown to support them. We can probably provide food, we can probably provide medicines, but we can't provide the emotional support they all need. And whatever it is, if they need physical support to care, it is the responsibility of the children who are living abroad and earning in dollars to please have a backup plan. Talk to your parents of how they would want to be treated in an emergency. Put a name of list of people whom they should contact in an emergency, the doctors, the ambulance, the nursing home, so they feel supported and they are not desperate like most of them have sounded. And I remember in the peak of lockdown, in the peak of COVID, every day there used to be a friend saying, "My mother has COVID positive. My mother has fallen in the bathroom. My father has hit a head. My father has had a stroke. What can I do sitting in Mumbai for a Delhi parent or a Chennai parent?" It is the responsibility of the children. And if it's fine to make a life of your own, but I guess you are there because of these parents.
Absolutely.
Please make their lives safe and complete by full planning. Nobody is telling you to cut your dreams and come back. And probably in the lockdown, you couldn't even have come back. But NRI, it has been gut wrenching to see them watch funerals on Zoom, to say goodbyes on a WhatsApp call, and not even be there. I know families couldn't even be there for COVID patients, but at least you knew you could probably do the last rites when the government ruling changed. But to come back to a city and never see a parent again,
heartbreaking,
can be really bad. And I think these experiences have taught me that yes, though I know my mom stays with me, And I know during the first lockdown, I had a horrible time with her vertebral fracture, with no maids, with me changing diapers, with me sleeping with her and not able to sleep because she would get up at any time and struggle to get out of bed. And you feeling down and low yourself. And then when she improved, still you have your own bickerings and arguments. But I really think you realize how fragile and helpless a senior citizen is. And even with me around, sometimes I felt that my mom wished she could have more support. I can't imagine how elderly feel when they're all by themselves. So I think that is something that has really hit me during the pandemic.
Yeah, I know. I have goose flesh listening to the stories, Rajam. And for the viewers, have you seen how much human our doctors are? They've experienced what we have experienced. They have experienced the same sense of helplessness, the same sense of loss, the same sense of not being able to do things, and also pain. They have felt pain too. So let's not forget again, like Rajam again and again says, they're not God, they're humans. So keeping that in mind, when Rajam spoke about what she's been through and also about the elderly, which is again a very, very pertinent point you've raised. Elderly in India have taken a huge hit, a massive hit, because of children being abroad, and they have no one around them. And how much can friends also do? They have their own lives as well. And doctor friends, they are taking care of patients, they take care of their homes, and then they have the additional burden of taking care of parents of their friends, which is too much. They can do so much only. So thank you for highlighting that, Rajam. And also, when all this is going on, even now, with third wave somewhere around the corner, how do you take care of your own self, your emotional self? Because with your mom at home, I'm sure when you do go out visiting hospitals, you do fear, and what if the infection comes back home? So can you talk about that also?
So during the first wave, I think I was kind of getting used to the new normal of doing things differently, discovering this virtual world, connecting with people online, doing consultations online, etc. And I think like most of us will agree, the first wave, because of the strict lockdown, COVID didn't really come to doorsteps. I think it was the second wave where I used to dread picking up the phone. I used to hate looking at WhatsApp messages because every message and every call was like a call of doom. It's either somebody I know, or or my cousin's friends, or my family friends, or it was just back to back to back. And I think that April, May of 2021 is something I will never. I think I also was at all-time low, and I didn't even have the time to or the bandwidth to want to relax, because I was just so sad all the time. And it was very evident by the way I was so withdrawn. And I think I was just doing one thing, ticking the box every single day. But I think one thing that helps me is prayers. I have belief in somebody supernatural. So I started doing this small ritual with my mom, which used to take about 20 to 30 minutes. Though we used to chant every evening from last year, from the lockdown, we sat and chanted every year. And I've actually got familiar with this particular shlokas based in praise of Lord Krishna. So that is something I do with my mom. And I think it also gives us quality time together to do something, not talk of health, but do something creative, and it gives a lot of peace. So prayers is something for the Lord to save us from and deliver us from this horrible time. The other thing I do is I train in Carnatic vocal classical. So twice a week, I actually shriek my lungs out with my teacher. Again, it's online, but it's something, I learn one new song every 15 days. So that keeps me going. Yes, I also tend to try and keep my regular exercise, which is like yoga and walking. And that's also the quality time I end up spending with my banker husband. And since he's in essential services, he's not taken a day off either, because, and I think with online at all-time high, the fraud is also at all-time high. So, my husband's also been very busy and has his own levels of stress with fewer people working in the bank, and the work in the bank being the pace being slower. So, like you said, it's affected everybody. So,
Mm.
so I think exercise, music, chanting, and also, trying to, it's like with mom around, it's like entertaining a child. So discovering new ways of entertaining her. So we've devised this method by which once a week she has a WhatsApp chanting group with all her
Oh,
siblings, or
okay.
she then has a Zoom party with all the building friends so that at least they see each other. Or then she sees some recipe channel and she tries some new recipe. So something to keep her entertained. Then we also, mom and me, with the help of our maid, we grew some vegetables. So the joy of seeing one capsicum, or the joy of seeing one karela, and then she proudly telling her sibling that today I had homegrown karela sabji, or so these are the small things which we've kept motivated. And during this period is when she also became a great grandmother. So my nephew
Okay.
had a baby girl in Melbourne. So we watched
Okay.
Mia growing up only through digitally. And so
Uh-huh.
every day since day zero, we've watched her grow up. And September, she turns 2.
Oh,
So
okay.
that's been another highlight, because we kind of time our meal times with her meal times, because
How
our lunch
lovely.
is her dinner. So
Hmm.
we watch her every day while eating lunch. So these have been the few moments where we have, kind of tried to do on a regular basis to remain sane. But
Same
yes,
here.
I think all of us, like I keep saying, COVID-19 needs you to be socially distanced. I think it's very important message to be emotionally connected. Physically, we need to be far away, but we really need to try that extra limit. I have only one sibling who's lived in Melbourne since 1984, and she has 2 children. And despite the fact that we grew up in 2 different continents, her kids are very close to mom, dad, and me and my husband. And I think
Oh,
it's the effort from both families. And I think when you see people uh, wander away, or relationships
yeah.
kind of scatter away, you feel sorry for good true relationships, even friendships or family relationships. But I think it's an effort from both sides, and I think we really need to be emotionally connected at this time, now more than ever, because you can't just book a plane ticket and fly to Australia and see them, or they can't, which they used to 4 to 6 times a year, because my parents couldn't travel after a particular age. So I think it's very important to stay connected, to do those small things amongst each of us. And even doctors really appreciate that little bit of a thank you, or a how are you back message, which really helps them to, kind of fuel their day.
Yeah. And you have on so many forums emphasized on staying emotionally connected, because if you are emotionally connected with your loved ones, it automatically becomes a support structure around you.
Absolutely.
And whatever Rajam has spoken about, are the viewers able to relate to it? You and I have also been through the same kind of issues, the same kind of struggles. So see, the life of our doctors, it is so much like ours. When they come back home, they practically do what you and I do. So with that in mind, Rajam also talk about how the mental health of our healthcare professionals has been impacted, especially the young doctors and doctors who have just started their practices or just started their work.
So if you actually rewind 30 years, there are times when I wake up saying, what if I had just joined my MD and the pandemic would have hit? How would I have behaved? I would have crumbled. So hats off to those kids at 20 and 22 to be in public hospitals, given the way their living conditions are, their canteen conditions are, and their working conditions are. I am in complete awe of those 20, 21-year-olds, because in life they have also haven't seen much. And I in fact, have spoken to a couple of people in the metros and in non-metros medicals recently. I was just trying to find out what all they went through, and the ghastly stories of non-availability of PPE,
Yeah.
non-availability of medications, knowing that yes, steroid will help this, but there was only that much steroid to give that many patients. It is gut wrenching. These kids have really worked non-stop, day after day, week after week, and month after month. And I think we owe it to them to use our freedom responsibly and not let this third wave be as bad as the second and first. We don't want, and these could have been any of our children working in the
Absolutely.
wards. And it's absolutely, it's like really sending them to battlefield. And I think
Mhm.
that many people will relate to, when you send your young sons and daughters to a battlefield, it
Yeah.
is just like that. And here the enemy is completely unknown, unseen. And I think these children have really gone through a lot. And it starts from right from the fact that nobody thinks of asking how they're coping. They're all working on their own. They're all unsupported. We needed as many hands as we could. So it's not that, people had teams of doctors to help them decide. It was on the spot decision. So I really think the doctors, the nurses, the staff, the support staff, very important to see how they clean, how they pack the bodies, how they dispose the disposable stuff like gloves. We no work is below dignity. We can't and we shouldn't be looking down upon what we used to call as class 3, class 4. I think they are support staff. Without them, even this much will not run in a public hospital.
Absolutely.
I think everybody, the police, the fire people, the pharmacists, the chemists, all those people who have worked relentlessly. And we should stop for a moment and thank all of them, because I think it would have been way worse if our health system had not been able to gear to how much ever they did. Yes, it is for our authorities and our politicians to now realize what all we need to do in our healthcare, whether we see another pandemic or not. We really need to gear up our healthcare system and improve our living standards of our doctors so that the next generation takes to medicine. I know of many people who are disillusioned and who
Yeah.
actively say that I don't want to go into medicine. We've seen even in the West, in New York, I can share an article as to how so many emergency doctors committed suicide because they just couldn't handle it more.
Yeah.
And I really think in India, being the social support being good and the spiritual belief being strong, I think we haven't heard of many suicides amongst doctors during the pandemic. But I really think we can't take this for granted, because I think the next pandemic looming is mental health, not just amongst doctors, but also amongst common people. So again, my importance to reiterate that we really need to be there for each other emotionally, socially, psychologically, and we really need to stop and think before we talk ill about any profession, any human being, because I think all of us have the good and the bad, and we really need to take the good along so that we move along and see the pandemic behind us.
It's so such an important message, Rajam, you've given to our viewers listening in. And also another very, very pertinent thing that Rajam has raised is about the young doctors. My God, I mean, doctors grow with time. And for the youngsters to have seen so much right in the beginning of their medical career, I don't know how it would have impacted them mentally. So let's support them. Let's not question them. Let's do our best. And like Rajam says, a small thank you, a small little chocolate. Go give it to them. It doesn't, cost much. This love from you will make them feel special. So we can do our bit to make them feel good and special. Um, Now I'm going to ask you a personal question, Rajam. You've been in the thick of it. Did you at any point feel, oof, too much?
I think the second wave, I was ready to hang my boots and said, oh, too much. There was just so much of loss, pain, and suffering from people that I had exhausted of, my capacity of saying, hang in there, it'll be better, we are there for you. Because like I said, I was dreading picking up every phone call or seeing any message. And though one was busy trying to do work, advocacy, training, etc., but still there was this constant fear of being in touch with each of those patients, whether they were in home quarantine or hospital quarantine or ICU, managing the trauma of the patient, managing the trauma the family was going through, because this illness is so weird that they cannot be together, making difficult decisions. I think, yes, in the second pandemic, I had enough. And there was no escape. There was no getting away. And it was all this constant feeling of doom, and that something awful is going to happen soon, and I think it can be, and I think even Bhavna very often realized, friends also realized, that there's something amiss, because this is not the usual gregarious Rajam, but I think it really gets to you. And, there's only that much you can do when you're not able to be next to a friend who's grieving. And I think one of the things that really hurt me was my own medical school teacher, my MD teacher, lost her 39-year-old nephew due to the pandemic. And I know this boy because right from the time I knew my teacher, she used to talk about him every single day of my training. And the worst part was that the manner in which he died without getting a hospital bed. And and after 5 days after he died, my teacher's mother passed away, and she died in grief of losing her only grandson. And this somehow was really rock bottom for me. I mean, the helplessness, how death can affect, and this is what you've been trained for, to help people during this time, to try and save lives. And then when you can't do it for your own, especially when it was reversible, it can be really, really gut wrenching. And I think, there have been times during the second wave when I've really had enough.
Thank you for staying on. I'm going to crawl through the laptop and give you a big hug, because I also know of doctors who actually said, we're not going to practice. Yes. We can't do it anymore. So, just grateful to all of you who stayed on in spite of your personal struggles. And a big hug to you for that. Message to the people.
My message to the people is, this virus is only a year and a half, but it has really changed the way we lead our lives, and also changed the way we interact with people, share our feelings, and meet people. I really want each of us to think, like I said before, this is the time for all of us to be as kind as possible, as grateful for being alive today to be able to talk to you, and as compassionate to each other. And my one biggest request is, please motivate at least 2 people every day to get vaccinated, because vaccine is the only way out of this pandemic. May not be 100%. It does have side effects, which are minor and controllable with paracetamol. The amount of complications that occurs with the vaccine is way less, 0.00001% less than what COVID can do. Please let's help us, ourselves and each other, by motivating 2 people every day to vaccinate. And I know that the government centers do not have the vaccines. So adopt 2 families, each of us who can afford to pay for their vaccines, to see to it that everybody is vaccinated. We need 70% of Indians to be vaccinated. And today we are at a staggering 5. So there's a long road ahead. Please motivate each other to get vaccinated. I know educated people are also not getting vaccinated. And I know there are still senior citizens, patients with comorbidities who are still not vaccinated. Please don't let COVID get this victory. We are very lucky in the 21st century to have a vaccine within 18 months of the pandemic, unlike our forefathers. So please use this opportunity to influence people to vaccinate. That is my request to all of you.
Get vaccinated, people of India. That is the only way we can save ourselves, reduce the work pressure on our healthcare professionals, and also somewhere control the virus from further mutations. What do you think about the Caregiver Saathi's initiative of humanizing our healers?
I think it's extremely important. I think in India, like I've been saying all through this chat, Unfortunately, there are people who treat doctors like gods, and there are people who are ready to beat up doctors. And of course, there is a bunch of people who are very nice and courteous and have a healthy relationship with doctors. But I also think that yes, the trust and faith with healthcare professionals in India, as Dr. Rajgopal always says, who's the father of palliative care, is at all-time low. People don't trust medical profession that easily, and some of it we need to introspect. We doctors ourselves need to sit back and think, why were doctors 50 years ago respected, and why are doctors being treated this like this now? And I think the answer really lies in a lot of things that medical school doesn't teach you, and that is soft skills, which is, if you break it down, it is self, other, feeling, thinking. Soft. So if people in the medical profession are taught soft skills, are taught the principles of palliative care, I think the bunch of doctors we create will be empathetic and compassionate. And like I say, we will not be able to have solutions for everything, but at least we will be able to acknowledge and address the trauma, the grief of the person sitting in front of us. And I think what I learned in one of the sessions with another colleague is, when you are supposed to empathize with people, you're actually supposed to fit into their shoes. But
Yeah.
are doctors ready to remove their own shoes first? Is the most important thing. So I think somewhere even doctors need to come down from their pedestal, get to the level of their patients, to know what is going on. To simple things like, is your patient able to walk to the toilet on his own, or is your patient able to feed himself? These are irrelevant for the doctor as far as the medicine is working, but no, it is very relevant for that particular human being, for his independence, for his morale, his dignity, his respect. So I think even we as doctors need to introspect. There is something that we also need to change. And I also request, like I say, people when they are angry, people when they are upset, they do tend to talk rudely, or are ready to abuse, or even probably physically abuse. And I think that is the level where, just like road rage, we need to think and say that they are not, their their anger is not directed towards you. So we doctors also need to learn to treat and handle these situations of angry relatives. And that comes purely with practice. It is a skill that can be learned. Communication skill is not something that you can be born with. It is something that you learn during your life, you learn from your seniors. And so I think attitudes, ethics, communication skills, palliative care must be an integral part of the training for all doctors. And I think we will become much better, compassionate human beings. Because if you see, Vandana, there are, say, for example, 10 chest physicians. Not all 10 chest physicians with the same degree do well. What is the difference? What is that difference between doctors doing well and not doing so well? If money is a form of success, or if number of patients is a form of success, I think very often it is the way you talk. It is how you talk, when you talk, and how much you communicate with your patients. So I really think, I don't think if you have 100 patients and if doctors are not able to see you in the next 2 months are the best doctors. I don't think busy doctors are the best doctors. But I also don't want to very much emphasize that doctors who are not having given you the time to talk to you, doctors who are not able to communicate and be there in your time of distress, I really think you need to sit and think of whether that doctor is meant for you, because everybody's needs are different. So it has to be tailored along with that. So it's not just the fault of the people, it is also some introspection. But road rage really gets people nowhere. It's going to end up in a disaster.
Absolutely.
Somebody has to be the one who diffuses the anger and settles and manages that situation.
And also, like you say, empathy goes a long way, Rajam, and also in rapport building. Sometimes a patient just needs a little bit of empathy. Even if it's a life-threatening condition or an illness, a little bit of empathy can just help build the rapport for the, between the doctor and the patient. And maybe at that moment, that is what is required for the acceptance from the patient as well. So empathy is such an important part of of any medical, treatment or medical intervention. I work with palliative patients as a counselor, and I know sometimes all that matters is you sit with them, speak to them kindly, and that is what they need. That is what they want. And like Rajam says, for doctors also, we rely on you, we look up to you, but also it's important that sometimes you need to come down and be with your patient as one human to another. So with that, any moment of maybe any anecdote that you would want to share with us as we come towards the close of this conversation?
So, I mean, is it related to the pandemic or not?
Anything.
You want to end it on a happy note or a little lighter vein?
Yes.
So, I mean, I think one of the things I can remember is we were January of this year, my husband and me were supposed to go to meet my mother-in-law in Chennai, and we had booked tickets, and we hadn't seen her the entire of 2020 thanks to the pandemic. So I know at 88, she was really looking forward to seeing us. She lives with my brother-in-law in Chennai, and we were also very happy to, we were very keen to go and see her. And, it was the end of the first wave and numbers were low. I had already got my one vaccine. So, we were all very confident about traveling, etc. And I remember my husband calling and telling me that he met with a friend the day before. So we were supposed to travel on a Tuesday, and he had met somebody on Saturday. And when he went to work on the Monday morning, he realized the man whom he met on Saturday had turned COVID positive, and all hell broke loose. And I said, you cannot go to work. I mean, he was already in office. I said, but if you've met somebody who's has been now detected COVID positive, and you've shared a cup of coffee, even if it was across the length of the table, you are obviously morally irresponsible to go to work. So he came back, and then I had to arrange his RT-PCR. And I know, that. So, this is like how I know exactly how patients feel. That 12 hours after his RT-PCR, one was about what his report would be. Two, he had been at home. So my 82-year-old mom was also exposed to him. Three, his 88-year-old mother has been waiting to see the prodigal son come home after 1 year. So the expectations and, amount, I must have prayed to Lord Krishna for that report, which came at 5 a.m. on the day we were supposed to travel under relief. And I know exactly what patients must be going through. And I think these are the instances which actually make you realize that, everybody is human.
Yeah.
Everybody goes through the same thing. It's just that people are different levels of expression. And the fact that the relief that we could get onto that plane and go and meet and have a safe trip, from to and from Chennai. But, this is one of the anecdotes where I feel that, we all go through that. Whenever we do our blood sugar, our lipid test, our sonogram, mammogram, all of us go through that.
And the palpitations to the results.
Procrastination, try to delay it as much as possible. And then fingers crossed till we get the report. So we are all human. And I think really we need to respect that and treat each other like that.
Yeah. Perfect way to wrap up our Humanizing Our Healers conversation. Thank you so much for giving your time to us, Rajam. And what a wonderful conversation we've had. And just grateful that you are here and you've shared your experience and point of view. Thank you so much. It's been a pleasure.
Thank you so much for this chance, Caregiver Saathi. Thank you for being such a patient listener, Vandana, and thank you to all the people who helped this happen. Thank you once again. And I really am happy to share a lovely article, if you want to put it up on the site of Caregiver Saathi, about gratitude and how scientifically it's proven to be so beneficial for all of us. So I will post it to you and you could share it on the website. Thank you once again for today. Thank you.
Thank you, Rajam. Thank you very much.